Welcome, everyone. Thank you for joining us for today's CITI program webinar. Today's topic is Research Equity and the Part We Play, and is presented by Nicole Fisher. Nicole is a public health and research ethics professional with over 10 years' experience in conceptualizing and implementing programs that address health inequity and inclusion of diverse populations in clinical trials. She serves on the board of directors for Heartland Alliance Health, a FQHC in Chicago that serves the most vulnerable populations, including families experiencing housing insecurity. Nicole is also the host of the True Crime podcast, Clinical Mistrials, which explores the historical medical mistrust of racial and ethnic minorities in research.
So we're going to talk a lot today, but our high-level objectives are going to be around how we ensure diversity in clinical trials and how that also ensures research equity. Also, how can we achieve that through building trust and transparency in research? Last, we're going to talk about how important ethics are in this process. Sponsors, we can do so much more. And honestly, I think that we have an obligation to. Because in the end, it really falls on us to set the standard. We have the power to expand eligibility criteria in late phase drug development to include, for example, patient mutation types that are typically associated with people of color. We can also design broader study endpoints that would prove effective for more of that disease state population. And in my past life working at hospitals, I would stay up drafting proposals for clinical trial engagement and outreach, and I peddle it around the hospital. But at the end of the day, it came down to having the funding, and also it came down to our limitations at site in our clinical trials. And really, that's the reason I got into pharma. I had to reconcile with the fact that, we had to build in what we want and what we need at the source, so at pharma. And I would call that research equity by design. How are we reimagining our research practices to achieve this research equity? Okay, we can consider the following. Are we developing research questions with our patients in mind or our participants in mind? Are we studying what they're most interested in? So what they at their community level really want to know? Are we giving them fair market value compensation for their partnership? And are we doing that in ways that we would any other vendor? Patient advisory groups and patient IRBs are examples of that kind of partnership. Kind of harkening back to the previous example, had we not established a patient advisory group, we would not have been successful in implementing that forum with Henrietta Lacks within the community. It just wouldn't have happened. Lastly, we in industry, we need to develop partnership programs with clinical sites, with FQHCs that financially support their efforts in education, in outreach, and in their recruitment for our trials. I think this is the most important and it's the most interesting to me. And I'm doing this work the best I can where I'm at now, but just thinking about developing programs that allow hospitals, clinics, community centers to submit requests for proposals or requests for funding in order to be funded and collaborate together on initiatives that improve health and research equity. However, and when I say that health and research equity, however, that is best defined by their own community needs and their own community needs assessments, right? Because they know what they need best. So in summary for today, diversifying clinical trials, it's just good science, and it's especially good ethics. And collaborating to harmonize our industry practices for both clinics and for pharma, that contributes to our aim of research equity. And we can improve research equity by intentional design. Also, trust and transparency, that's going to be imperative to our recruitment of historically marginalized populations. And lastly, human dignity is at the core of research ethics and our research integrity.
I also invite everyone to review our content offerings regularly, as we continually add new courses and webinars in various areas of research, ethics, compliance, and professional development.